I died for 2 minutes and 11 seconds. In that time, I saw my father, who'd been gone for over 2 decades, standing in a light more real than anything on earth. He looked into my soul and said, "You're not done yet." What happened next defied everything I knew as a Harvard-trained doctor. This isn't just a story about dying, it's about waking up to a life I never knew I was missing. I'm Dr. Jonathan Blake, a 38-year-old anesthesiologist at Mount Sinai Hospital in Manhattan. Ironically, I've spent most of my adult life putting people to sleep, safely, on the operating table. I never thought I'd become the one being wheeled into surgery, fighting for my life. It started as something mundane, a persistent discomfort in my lower abdomen, which I chalked up to long shifts and too much hospital coffee. But the pain grew sharper, more insistent. My wife, Elena, also a doctor, finally forced me to get checked. The CT scan showed what I least expected: a small mass in my intestines that looked suspicious. A biopsy confirmed it, a rare but operable tumor. We scheduled surgery at my own hospital. My colleagues were the best. Dr. Linda Cho, a brilliant surgeon I'd worked with for years, would be performing the operation. I trusted her with my life. Literally. The morning of the surgery, I kissed Elena goodbye and told her I'd see her in a few hours. I wasn't scared. I understood the risks, statistically minimal. I'd done the same procedure countless times for others. They prepped me like any other patient. 4 lines in, monitors hooked up. I remember the mask coming over my face, and the familiar scent of sevoflurane. Then darkness. What happened next, I only know through the whispers of memory, and later, the hospital records. About an hour into surgery, something went wrong. An artery nicked, blood pressure dropped, and the team scrambled to stabilize me. My heart stopped for 2 minutes and 11 seconds. I never felt the crash cart. I never heard the frantic calls or the alarms. What I remember is something entirely different. I remember floating above the room. I know, it sounds cliché, like a scene from a Netflix drama. But I swear to you, I was there, looking down. I could see Dr. Cho's face turn pale. I saw the nurse, Jake, hand her the clamps with shaking hands. I could even see my own body lying still, lifeless, on the table. And then, everything changed. The sterile white of the operating room faded. I was surrounded by a golden light. It wasn't blinding but warm. I felt peace, more profound than anything I've ever known. I wasn't afraid. I wasn't even thinking about my body anymore. That's when I saw someone standing in the light. A man, older, with a kind face. I recognized him instantly. It was my father. He died of a stroke when I was 17. I hadn't seen him in over 2 decades. "Jonathan," he said, smiling. "You're not done yet." Just as quickly as the light had come, it faded. I felt a jolt. Like being yanked backward through a tunnel. I was somewhere else entirely. The experience haunted me. Not in a terrifying way, but in the way a song you can't place lingers at the edge of your mind. That light, my father's voice. "You're not done yet." What did that mean? What wasn't I done with? Back at home in our apartment in the Upper West Side, I sat at the window, watching traffic buzz down Amsterdam Avenue. I was alive. My wife, Elena, sat beside me most evenings, sipping tea, reading. But I couldn't concentrate on normal life. It felt trivial. I'd come so close to something extraordinary, something eternal. And now, everything around me felt temporary. I dove headfirst into research. Near-death experiences, or NDEs, weren't as rare as I thought. Thousands of cases, across countries, cultures, religions. People who had never met shared the same descriptions, floating above their bodies, seeing loved ones, experiencing indescribable peace. Many reported being told it wasn't their time. Like me. One story stood out. A woman in Seattle, a lawyer named Sarah Mather, who'd been clinically dead for 6 minutes following a car crash. She described meeting her grandmother in a field of light. Another man in India reported being greeted by a spiritual figure in his own cultural context. Different faces, different languages, but the message? Uncannily similar. I reached out to Sarah. We had a long Zoom call, me in my living room, her on her balcony with the Seattle skyline behind her. When I told her my story, she didn't blink. She just smiled and said, "You've been touched. Life will never look the same again." She was right. At work, things were different. Colleagues looked at me with awe, some with concern. One nurse asked if I'd seen heaven. Another, an atheist, asked if I thought the experience was just brain chemicals. I couldn't prove anything. But my heart said otherwise. What changed most, though, was how I saw people. I used to move through the hospital mechanically. Efficiency first, emotions later. But after the experience, I slowed down. I listened. Really listened. Patients in pain. Nurses under pressure. Families holding on by a thread. There was one patient, a janitor named Marcus in his 60s, who had advanced pancreatic cancer. I sat with him during a break, and he asked, "Doc, what do you think happens after we die?" I told him the truth. "I think it's beautiful. I think you'll be welcomed. And I think you're not alone." He smiled with tears in his eyes. I didn't know what my father meant by, "You're not done yet." But I was beginning to understand that maybe my work, real work, was just beginning. Confronting doubt and faith. Even as I embraced this new sense of purpose, doubt crept in like a shadow at dusk. I'm a man of science. I was trained to believe in data, cause and effect biology. But what I experienced, what I remembered with such clarity, defied every medical model I knew. I reached a point where I couldn't keep the duality inside. One morning, I stood at the pulpit of St. Patrick's Cathedral, not during a service, just there alone. I'd walked in on impulse after a restless night. The high arches and stained glass felt reverent, calming. I sat in a pew and whispered, "God, are you real?" I hadn't been to church in years. Not since my father died in 2003. Back then, I'd raged against God, against fate. A 17-year-old boy watching his hero collapse from a stroke with no warning, no mercy, it broke something inside me. That's why seeing my father during my near-death experience felt so impossible. So healing. He looked like he had when I was a boy, his flannel shirt, his kind eyes. And his words, "You're not done yet." They echoed in my mind daily. I began seeing a spiritual counselor, Father Mark Reynolds, an Episcopalian priest and former trauma chaplain at NYU Langone. He had a background in both theology and psychology, and he didn't flinch when I told him what I saw. He listened, nodded, and asked, "Do you believe it was real?" "Yes," I said. "More real than anything." He leaned back and said something I'll never forget. "Jonathan, sometimes God lets us peek behind the curtain, not to escape, but to return changed. To carry the light back to others." I asked him if I should start going to church again. He chuckled gently. "Start by praying. Start by listening." So I did. At home, Elena noticed the change. She'd always respected faith, but neither of us practiced much. Now I woke up early and sat quietly for 20 minutes every morning, listening. Not asking. Just listening. One night, I had a vivid dream. My father stood at the edge of a river. The same peaceful light surrounded him. He didn't speak this time, but he smiled and pointed behind me. I turned and saw Elena, older, with gray in her hair, holding a baby. Our baby. I jolted awake with tears in my eyes. We'd struggled with infertility for years. Several attempts, all failed. We had stopped trying. That morning, I told Elena about the dream. She listened, squeezing my hand. We didn't make any promises, but something unspoken passed between us. Maybe, just maybe, we weren't done trying. At work, I continued to encounter patients facing death. I began volunteering once a week with terminally ill veterans at the Bronx VA. I didn't go to preach. I went to sit. To listen. To share peace. It wasn't a perfect journey. I still had doubts. But I was starting to understand, faith isn't about certainty. It's about walking into the unknown with eyes wide open. A message confirmed. It was a Tuesday afternoon, nearly 4 months after the surgery. The air outside was crisp, early March in Manhattan. I had just finished a shift at Mount Sinai and was walking through Central Park on my way home. I stopped at Bethesda Terrace and sat on the steps, watching a street performer play a mournful rendition of Hallelujah on his violin. A woman sat beside me. Not someone I knew, but her presence felt oddly comforting. She looked about 60, with a gentle expression and silver streaks in her hair. We exchanged casual greetings, and then she said something that froze me in place. "You've been touched by the other side." I blinked, stunned. "Excuse me?" She turned to me with eyes that seemed to see straight through the layers of my soul. "You saw someone. A father figure. He told you that your time isn't done yet." I physically recoiled. "How do you know that?" She smiled faintly and reached into her coat, pulling out a worn paperback book, Embraced by the Light by Betty Eady. "You're not the only one," she said. "It happens more than we talk about." We spoke for nearly half an hour. Her name was Margaret Lewis. She was a retired nurse from Queens and had experienced her own ND after a stroke 5 years earlier. Her story was eerily similar, floating above her body, encountering deceased loved ones, and being told she had more to do. Margaret wasn't religious in the traditional sense, but deeply spiritual. She believed we're all here for a purpose. "You don't have to understand the whole path," she said. "You just need to take the next step." When we parted, she placed her hand over mine and said, "Don't ignore the message. That kind of clarity is rare. Follow where it leads." That night, Elena came home from her shift at Columbia Presbyterian with a strange look on her face. She sat down slowly, holding an envelope. "I had a test run last week. I didn't want to say anything until I was sure," she whispered. I stared, my heart thudding. She opened the envelope. Inside, a single slip of paper. Positive. We were pregnant. I couldn't speak. Tears streamed down my face. I thought of the dream, my father, the river, Elena holding a child. It hadn't been just a dream. It had been a message. A glimpse of what was coming. The next few weeks passed in a haze of joy, fear, disbelief. We told only our closest family. Given our history, we were cautious. But as the days passed and the baby grew stronger, I began to feel something I hadn't in a long time, complete. I returned to Father Mark. When I told him everything, Margaret, the pregnancy, he just smiled and said, "Now you see. Life doesn't just happen to us. Sometimes it happens through us." I finally understood. My father hadn't just said you're not done yet because I had more years to live. He meant I had something to give. A second chance. The day we heard our baby's heartbeat was the moment everything shifted again. It was early April, a sunny Monday, and we were in a small exam room at Columbia Presbyterian. Elena lay back on the table, belly just beginning to show. The technician adjusted the probe and then, there it was. A fast, fluttering rhythm, strong and insistent. We both wept. That sound, that tiny beat, reminded me of the one I'd lost, my own, during those 2 minutes and 11 seconds on the table. Now, this little life was forming inside the woman I loved, carrying the echo of what I believed was a divine message. It wasn't just biology. It felt like restoration. At Mount Sinai, I took a short sabbatical, not just for Elena, but for myself. I needed to process, to reconnect. I spent mornings walking along Riverside Park, afternoons volunteering with hospice patients, and evenings journaling. I even began drafting a manuscript, The Light Above the Table. I didn't know if I'd publish it. Maybe it was just for me. But something inside needed to tell the story. Then, something unexpected happened. The hospital administration asked if I'd be willing to share my experience with the Medical Ethics Committee. At first, I hesitated. Talking about spirituality in a clinical setting was tricky. But they reassured me, they weren't asking me to preach, just to share. So I did. I stood before a group of about 30 physicians, nurses, administrators, and told them everything. The vision. The voice. The out-of-body details I couldn't have known. The pregnancy. Margaret in Central Park. I could see skepticism in some eyes, but curiosity in most. When I finished, Dr. Cho, the very surgeon who had saved my life, approached me. "I used to think we were gods in there," she said quietly. "Now I wonder if we're just being used by something much greater." She wasn't alone. Over the next few weeks, several staff members approached me privately. One nurse, Angela, shared her own childhood near-death story. A surgical resident said he'd lost his mother recently, and had been praying for a sign that she was at peace. People were opening up, not just to me, but to the possibility that science and faith didn't have to be enemies. That maybe there was more. Meanwhile, Elena and I were thriving. She glowed in a way I'd never seen. Our evenings became sacred, slow dinners, belly-listening rituals, prayers. We didn't have it all figured out, but we knew we were living on borrowed grace. One evening, we took a walk along the East River. She looked up at me and said, "Do you ever think maybe the whole thing, your surgery, the experience, even the pain, it was all to get us here?" I nodded. "Yes," I said. "I think the near-death was the beginning of real life." Full circle. Our daughter, Grace Olivia Blake, was born on November 18, 2024, at 3:12 a.m. in the same hospital where I had nearly died just a year before. The irony wasn't lost on me. Life and death, beginning and end, all tied together within the walls of Mount Sinai. Elena had a smooth delivery. When I held Grace for the first time, her tiny hand wrapped around my finger, and I broke down. It was overwhelming. The sound of her first breath felt like the universe exhaling. We named her Grace because that's what she was. A gift. A reminder of mercy. Of restoration. Olivia was my father's favorite name, one he used to say he'd pick if he ever had a granddaughter. And then, pain. Noise. Panic. Beeping monitors. I was back. Alive. Aftermath and the unexplainable. The first thing I remember when I came back was the pain. A deep, raw ache in my chest, like my ribs had been cracked open, which, I later learned, they almost were during CPR. My eyelids were heavy. I heard voices, fragmented, muffled. Then one word came through loud and clear. "He's back." I opened my eyes to blinding lights and chaos. Elena was there, standing over me, her face soaked in tears. Dr. Cho had stepped back, hands still trembling. I could see the terror slowly drain from her expression as I blinked and whispered, "Hi!" They stabilized me, moved me to recovery. But the air in the room had changed. People looked at me like I wasn't supposed to be there, like I'd cheated death, and maybe I had. Word spread fast. Not because of the medical drama, that happens, rare as it is, but because of what I began telling people. I couldn't keep it in. I told Elena about seeing my father. I told her about the light, the peace, and the words, "You're not done yet." Her face twisted between scientific skepticism and quiet disbelief. She wanted to comfort me, but I could tell, she thought it was just the drugs. Or oxygen deprivation. A neurological hallucination. But I remembered everything with crystal clarity. The angle from which I saw the operating room. The exact order of the tools Jake handed Dr. Cho. A phone ringing down the hall just before my code. When I described these details to the team, they froze. No one had told me any of this. Jake pulled me aside later that night. "Man, what you said about the clamp, that's exactly how it happened. I dropped it and gave her a different one. I didn't even tell anyone." I could see it in his eyes, he believed me. That moment shook him, maybe more than it did me. And believe me, I was shaken. Everything I thought I knew, about life, consciousness, the soul, was suddenly up for review. In the days that followed, I spoke to a priest. I spoke to a neuroscientist. I even contacted Dr. Bruce Grayson, a renowned near-death experience researcher from the University of Virginia. He asked if I'd be willing to document everything for a study. I agreed. I needed answers. Not just for myself, but for the other doctors who looked at me and saw a walking contradiction. Medicine says I was unconscious, dead briefly. But I remembered. Not darkness. Not dream. Another silent nod to the man who told me, "You're not done yet." In the weeks that followed, I felt my life recalibrate in a way I never expected. Simple things, changing diapers, nighttime feedings, watching the sunrise with her asleep on my chest, became holy. I no longer rushed through life. I inhaled it. I returned to the hospital part-time, not as the same man who had left. My colleagues could tell. I treated patients with a slower hand, a softer voice. I started speaking openly about death, not as something to fear, but as a threshold. Something we must prepare for with the same care we give birth. I started a monthly discussion group at the hospital, open to staff, patients, and families, called Conscious Conversations. We talked about mortality, fear, purpose, the possibility of life beyond. It wasn't therapy. It was truth-telling. People came and shared things they never had before. Grief, visions, signs. People who never would have spoken of spirituality were now asking bigger questions. And I never forgot Margaret Lewis. I saw her one more time, almost exactly a year after our first meeting. Same bench in Central Park, same quiet presence. I thanked her. She smiled and said, "You're walking the path now. The rest is between you and God." She stood and walked away, and I haven't seen her since. One evening, after putting Grace to sleep, I returned to the manuscript I'd started, The Light Above the Table. I finished the final chapter that night. I don't know if I'll publish it, but I know I needed to write it. Not for fame. Not for proof. But for anyone like me, someone who once believed that the body was all there was. If I've learned anything, it's this: death is not an end. It's a doorway. And sometimes, for reasons only God knows, some of us are sent back, not to boast, but to testify. My heart stopped for 2 minutes and 11 seconds. But in that silence, I heard everything I needed to live again. And now, every heartbeat is a reminder: I am not done.